happy to be here with you today to talk about a bill that was passed in California earlier this year. SB 729 by Senator Caroline Menjivar will expand health coverage for fertility and infertility treatment, including in vitro fertilization or IVF. And it will also update the definition of infertility to be inclusive of LGBTQ plus family planning experiences and ensure that anyone seeking to build a family has access to infertility care and treatment. One reason we're highlighting SB 729 is because it was a priority bill of the Stronger California Advocates Network. Stronger California is a coalition of over 60 organizations around the state. And for the last 10 years, we've come together to support a legislative agenda with both bills and budget proposals to advance economic security for women, families, and workers throughout California. One focus of our advocacy has been reproductive justice because we recognize that protecting reproductive health access is a vital part of ensuring economic security. So with that, I'm excited to introduce Craig Pulsipher. He's the Legislative Director at Equality California, which is one of the bill's co-sponsors, and he's going to tell us a little bit more about the bill and what it does. Hi, Craig.
Hi, good to be here with you.
Thanks for being here. So before we get into specifics about the bill, I just want to set the stage a little bit and sort of help folks understand why fertility treatment is a reproductive freedom issue. So can you tell us a little bit more about why access to fertility care matters and who it affects?
Yeah, of course. Well, thank you for having me on and for highlighting this bill. I think before we jump into the specifics, it's really important for folks to know that this really is a reproductive freedom issue. Oftentimes, when we think about reproductive freedom, we think about access to abortion and birth control, and that certainly is true, but really true reproductive freedom means that all people can decide if and when to start or grow a family. So that means not only having access to abortion and birth control, but also having access to fertility and infertility services like IVF. And unfortunately, California is behind on this issue, and very few people have access and health coverage for these treatments. And rates are actually lowest among low-income families, Black and Hispanic women, and LGBTQ folks. So California has a lot of work to do to be a reproductive freedom state. And when we look at this issue nationally, California is actually behind. There are 14 other states and Washington, D.C. that have already passed IVF insurance laws. So this bill was an important step forward to advance reproductive freedom in California. And of course, it's incredibly important to the millions of people who need access to fertility services to start a family. This includes about 1 in 8 couples who have trouble getting pregnant or sustaining a pregnancy, and LGBTQ couples, of course, who rely on access to fertility services like IVF to start a family of their own.
Yeah, absolutely. So it sounds like this was important for California to do just to sort of catch up and continue to be a leader. But I'm wondering if there was any reason that it was particularly important for us to do this now in 2024.
Well, there is certainly a lot happening nationally on this issue, both good and bad. But there have unfortunately been increased attacks on reproductive health care across the country. As I'm sure folks know, a couple of years ago, the Supreme Court overturned Roe v. Wade, and states can now set their own policies protecting or banning abortion without any federal standard in place. And over a dozen states have banned abortion across the US. But these attacks on reproductive rights have also threatened access to fertility services like IVF. Folks may know earlier this year that Alabama Supreme Court issued an extreme decision, essentially stating that frozen embryos should be treated as the legal equivalent of living children. And after that ruling, a number of providers in Alabama actually had to stop providing IVF services because of that decision. And thankfully, Alabama lawmakers acted quickly, and they passed protections for IVF so that services could resume. But IVF continues to be under attack across the country. Over a dozen states already have laws on the books that could negatively impact IVF. So really important in 2024, given attacks on reproductive rights and reproductive freedom across the country, for California to be a leader on this issue and make sure that we are leading not only in terms of making sure folks have access to abortion and contraception, but fertility services like IVF as well.
Yeah, absolutely. So thank you so much for that context. And with that, I'd love to talk about what this bill actually does. So to start, how does this bill change healthcare coverage of fertility and infertility treatment here in California?
Yeah, so California law on this issue is actually extremely outdated. It's over 30 years old. So under current law, health plans in California are actually not required to provide coverage for infertility treatments. They're only required to offer coverage for infertility treatments if requested by employers. And even worse, the law actually explicitly excludes any coverage for IVF, which is the most reliable treatment available. So these treatments are extremely expensive, run anywhere from IVF can run anywhere from $20,000 to $40,000. So obviously, without insurance coverage, these treatments are inaccessible for most Californians. So SB 729 helps to fix this issue. The bill mandates that large group health plans provide coverage of fertility and infertility care, including IVF. And so this bill will expand health coverage for IVF and fertility treatments for roughly 10 million people in California.
Wow, that's great. So you use the term large group health plans. Can you clarify what exactly you mean by that term, and who are these 10 million people that are going to be affected?
Yeah, so great question. So health insurance is complicated. So there are kind of different categories of health coverage. Most people in California get health coverage through their employer, through their job. This is called employer-based health coverage. Employers with 50 or more employees buy large group policies, and employers with fewer than 50 employees buy small group policies. So this bill specifically applies to employers with 50 or more employees, and that does include CalPERS. This is the program that provides health insurance to state employees and retirees. Obviously, we want to make sure that everyone in California has coverage, and so we do have more work to do, and this is work that we'll be doing over the next several years, is making sure that this coverage not only applies to large group health plans, but making sure that we're expanding that coverage to small group policies, and then also expanding it to folks who don't get health insurance through their employer as well.
Yeah, absolutely. So I know that you briefly touched on the fact that this bill is also important for the LGBTQ plus community. Can you talk a little bit more about how this bill affects LGBTQ plus families and why that matters?
Yeah, so obviously this was really important for Equality California. We're an LGBTQ civil rights organization, very focused on removing discrimination from our state's laws, expanding coverage and services for LGBTQ folks. Under current law actually requires really invasive standards of proof and standards that don't apply to most LGBTQ couples. So current law required needing an official medical diagnosis that could take years to achieve, and also having to complete a year of regular sexual relations without contraception. And that simply doesn't apply to most LGBTQ folks. And so what SB 729 does is it updates the definition of infertility to prevent discrimination against LGBTQ people and couples. Specifically, the bill classifies people as infertile who are either unable to reproduce without medical intervention, either as an individual or with their partner. So this is in alignment with model legislation that was created by national fertility groups. Similar definition has been enacted in other states as well. And so this was a really important piece of the bill, and it's really going to make sure that these services are accessible for anyone who needs them, including LGBTQ folks and families.
That's really exciting. I know that Equality California is an LGBTQ plus organization, and I also know that this bill is supported by a pretty large and diverse coalition. So can you tell us some of the key players in getting this legislation passed, and why is that support important?
Yeah, so it was a really large and diverse coalition behind this bill. Really want to give a shout out to the author of this bill. You mentioned Senator Menjivar. She is a lesbian who this was a personal issue for her. She understands the importance of LGBTQ folks having access to these services. But there were a ton of organizations that worked on this, fertility groups like Resolve and the American Society for Reproductive Medicine, reproductive rights and LGBTQ groups, labor groups who understand how important this issue is to their workers. The insurance commissioner, Ricardo Laura, was a key partner in getting this bill passed. So I think this really just reflects, the number of people that this issue impacts and how important this issue is, that it really brought a really strong and diverse coalition together to get the bill passed.
Yeah, definitely. So we're still waiting to hear when this bill will take effect. How can our audience stay up to date on that and any other news from Equality California?
Yeah, so stay tuned, for more updates on implementation of this bill. You can sign up for updates from us at eqca.org. You can sign up for regular email updates on this bill. But then, like I said, we still have more work to do to expand coverage beyond the large group market. And so we'll continue to work on this issue for the next several years until everyone in California has access to these services. So stay tuned for more.
Absolutely. Well, thanks so much, Craig. And I know that Stronger California was really proud to be one of the many organizations standing in support of SB 729, because this bill is a really important next step in our fight to ensure reproductive freedom and economic security for all Californians. So with that, we invite you to visit our Stronger California website at strongerca.org to see all of the bills we've passed in the past 10 years, advancing reproductive and economic freedom for communities throughout California. You can also sign up for action alerts to be notified about ways you can support these bills going forward. We also invite you to share this information with your networks. We want as many people as possible to be aware of these important changes to fertility care coverage in California, and to have the information they need to plan families in the way that is best for them. So thank you so much for being here. Thank you so much, Craig, and we will see you in our next update.
Thank you.